All right, good afternoon. Thank you for your patience today. Really glad you are all here. You all look so shiny, and I know the graduates look so shiny as well. So thank you for making the time to celebrate our graduating class of 2026. I am Nancy Freeborn. I am the newish program director of the PA program, and I would like you to turn your attention to the back of the auditorium right now and stand as we welcome the Mary Baldwin PA program class of 2026. What? You may be seated. Thank you again. We're so excited to be here. We're going to start with our first speaker. We're excited to have President Todd Telemeco give a greeting to you. Todd is also a clinician as a physical therapist, and in fact, in the day, he used to teach anatomy to PA students, including Professor Megan Adey. So he knows his way around the anatomy topic, and we welcome him.
Thank you, Nancy. And you guys are great. I did teach Megan, and I'm sorry if she was tough on you, but I was tough on her. So what goes around comes around. First of all, wow. Just think for a minute. You guys remember your first day? It seems like it was yesterday. Look how far you've come. I think the last time I was with this group, you were getting your first white coat. And when we talked about that transformation that was happening, going from didactic to clinical, the first time really going out with patients, and now you're transitioning to the full white coat, has a lot of meaning, right? Now you are more than just a student. You're going to be looked upon as the expert in the room, working with your team, your physician partners. A lot of weight and responsibility, and you've earned it here. You have still yet to earn it with your patient. Please remember, this white coat does not give you the privilege for everybody to automatically trust you just because you wear it and you walk into a room. That privilege comes with time, trust, communication, relationship building, all the skills you actually learned in this program with your peers and your professors. The time they took with you to get you through your difficult time, the tables will now turn, and you'll be dealing with those patients who are dealing with life and death, or serious situations, or even not so serious, but serious to them. And now the table turns, you have to put that empathetic hat on, that clinician hat, all in one. That's what medicine is, that art of healing. I think you guys even have a class called the art of healing, right? It is more about than just a prescription that you give. the medical advice that you give. It is about that relationship with the patient. I promise you this, that relationship will get you farther in the healing process than pure medicine alone. The data is clear on that. I'm so proud of you, and on behalf of Mary Baldwin University and the Board of Trustees, the faculty at large, I just say congratulations, job well done, but don't let it end here. Congratulations.
Thank you so much, Todd, Dr. Telemaco. You probably remember seeing him quite a bit in our building. I'm pleased to introduce our next speaker who is also in the building a lot, and we're excited to have Dr. Sheila Talbot speak in a moment. I want to give a shout out to her on it's a National Nurses Week, and Sheila has gone up the ranks in nursing and had been at Old Dominion University and came to Mary Baldwin a few years ago. She also just was recently appointed as our Associate Dean and Vice President of Murphy-Deming College. So we're excited to have her in this role, but also to greet you.
So thank you, Nancy. So I've only been in this role for a week. Okay, I started May 1st as the VP Dean of Murphy-Deming, and I have certainly worked with you guys in the periphery within the nursing department, and I am so honored that one of my first official tasks is being here at your white coat ceremony. And so on behalf of Murphy-Deming College of Health Sciences and the faculty, I just want to say congratulations. This is such a big achievement. You know, as you guys know, we do a lot of interdisciplinary things at Murphy-Deming, and our tagline is interprofessional by design. And one of the ways that we symbolize that within Murphy-Deming is that every one of our programs have a white coat ceremony. And so this ties you with those other disciplines, the physical therapists, the occupational therapists, the family nurse practitioners. So as Nancy pointed out, I am a family nurse practitioner, and I would also like to welcome you as my new colleagues. And so when I call for that consult, I really expect you to pick up the phone, okay? Congratulations.
Great, so great to have the words of wisdom or welcome from the two senior professionals. I also want to introduce and say greetings to my faculty. Like I said, I've been here not quite a year. As Professor Green reminded me, you guys, that I don't know as well as the next 2 years, you have had to have 3 different program directors. You had Dr. Duduk, you had Professor Green, and now me, and you don't know me quite as well. But I want to thank the faculty that I've been working with this last 10 months, and let's give a round of applause to Dr. Felicia Esteban, the medical director. Miss Megan Adey, your Director of Clinical Education. Miss Emily Green, who was the acting director. We're glad to have Miss Caitlin Powers, Superpower Instructor and ERPA. We have 2 brand new faculty members that started on Monday. So they don't really know any of you, but I think they did Journal Club with you. So I'm going to have standing at the same time Mr. David Suez and Miss Katie Pels. Let's welcome them. And I want to recognize another guest in the audience. You may remember Miss Simone, who helped with a lot of things. And now I'm going to introduce someone that I know a little bit, but you know a lot, which is your former medical director, Dr. Ben Farley. Please.
Good thing about going early is I'll be done. Desperate for a speaker, huh? Yeah. Truly, though, I am so happy that some of my favorite people in the world asked me to speak today. No, true. I'm really surprised, but I'm honored to do so. So, to do justice for this occasion, just this morning, I created 50 black and white PowerPoint slides, and you'll be tested immediately after the ceremony. Does that sound good? Madison, is that okay? Madison's my boss. All right, so moving on. What words of wisdom do I have to impart to you today? I hope I have a few. First of all, congratulations. Your white coat ceremony today is both to consecrate your commitment to your new role as a PA and to celebrate your accomplishment in becoming a PA too. And it is quite an accomplishment. You and your families have spent much time, money, and hard work to make this day possible. Please take this time to reflect and be proud of yourself. You set a goal and sacrificed blood, at least blood tests, sweat, and tears to accomplish this goal. I really do respect and applaud you for taking initiative and working so hard to attain your PA degree and your long white coat. But please don't forget gratitude either. Take this time to reflect upon the many people who have helped you on your journey. Think about your parents, your partners, your friends. Think about all the inspirational coaches and teachers you have had through the years, including your wonderful professors that you've had at Murphy-Deming, who I had the honor of working with for 11 years. Think also about the compassionate healthcare providers and or counselors that you have encountered, and even think about those people you don't know who have made this possible, including those who made the Murphy-Deming College of Health Sciences possible, and those who have made obtaining a good education leading to a good career in our country possible too. And if you're religious, even thank your God or gods for giving you the opportunity and resources to succeed. I think you get my point. Personal accomplishments are fantastic and to be celebrated, but what others did before you helped you to succeed, so please be thankful and strive to carry forward some of this grace too. And you have chosen a wonderful field to be able to do that. You will likely easily be able to find a good job with good compensation. You will be challenged intellectually and personally, and will always have the opportunity to grow smarter, kinder, and wiser. You will also have the daily opportunity to positively affect the lives of your patients and therefore the communities in which you choose to work and live. So again, be proud of yourselves for working so long and hard to accomplish your goal and to have chosen such a great field of endeavor too. Now for some practical advice. As I know you will, take your job seriously. To whom much is given, much is expected. People will rely on you for their health and well-being, and they will pay you a lot for this care too. Make it your responsibility to know what you're doing, and when you don't, and you often won't, especially when you first start out, do some research and or ask for help. Read, do continuing medical education, ask questions of your peers and your physician partners and specialists, read the ER notes, the hospital notes, the consultation notes, read the entire radiology report, not just the impression, and better yet, look at the images yourselves. Please do this to not only provide better care for your patient of the moment, but also to continually learn and to help your future patients too. If you graduate at the top of your class today, but you stop learning now, you will not be a good PA. Look at the vital signs at every single visit. And if they're not completely done, or if you don't trust them, just like in your H&P practicals, do them yourself. They are called vitals in capital letters for a good reason. Don't find yourself neglecting to see that your presumed well or stable patient had a fever of 103 degrees or a blood pressure of 80/40 or 220/120. Similar things have happened to me, so this is a lesson, okay? Regardless, if you realize later that you failed to see or recognize something important, don't be ashamed to revisit your patient or call them later. Their health, not your convenience or your pride, should be your most important concern. Remember, they are paying your salary. Listen to your patients carefully, thoughtfully, and respectfully, and examine them and think about their diagnoses and treatments in the same way. You will frequently be pressed for time, but do the best that you can in the time allotted to you. And if you do need to address other issues, but don't have the time, if you have the luxury, schedule another visit. Please don't always be cowed by your financial managers into never spending a little extra time with some of your patients. Sometimes it is absolutely necessary, and your patients will appreciate it too. The patient who has to wait because you spent extra time with the patient before them may not appreciate it at that moment, but they might later when they're the one that needs a little extra time, him or herself. Listen to your nurses and staff and the other professionals with whom you will work, including your physical and occupational therapy colleagues. Working at Murphy Deming as long as I did, I'd be remiss not to say that. All these people can provide valuable insights and treatment options to provide optimal care for your patients. Still, continually cultivate your own abilities and judgment and respect your own judgment too. Take your own health and well-being seriously. You will provide better, friendlier care if you are well-rested and content with your own life. So the same thing that you will tell your patients applies to you too. Eat well. A plant-based DASH diet or Mediterranean diet is good for most of us. Get at least 150 minutes of moderate intensity or 75 minutes of vigorous intensity exercise per week with 2 episodes of strength training per week. Get 7 to 9 hours of sleep per night on a regular schedule, at least as much as you are able to. You know, some of you will work night shifts, but at least as much as able to. Stay involved with your family and friends. If you move somewhere new, join a soccer team, but don't break your ribs. I broke my ribs with a soccer team. Or a book club, or a knitting club, whatever. Tutor some children, be a big brother or big sister, volunteer at the mobile clinic or food pantry. Find friends and social outlets. On the other hand, if you are comfortable being alone, that's fine too. Alone's fine, lonely's not. When you feel comfortable in your own professional skin, give back and mentor a younger PA or a PA student. Develop your intuition and skill in distinguishing sick versus not sick. What your patient tells you in their vital signs and physical exams are certainly part of that, but their overall appearance and your gestalt impression is extremely important too. Perhaps the most important skill you can develop. If someone looks poorly, try to define to yourself why. Are they pale, dry, lethargic, dyspneic? But even if you are having difficulty exactly explaining why someone looks poorly to you, trust your instincts and at least investigate further or ask for another opinion when your gut is telling you that all ain't so well. On the other hand, if your patient looks generally well, but the vitals or tests don't ignore that either, okay? Next is perhaps my most mundane but necessary piece of advice. You will still have bad days or weeks or even, God forbid, months. And you will still just have to grit your teeth, lower your head, and push through sometimes. You've all done this before, and I know you can do it again. I know you guys pushed through some heavy stuff to get to this moment. Calculus, organic chemistry, and even your best courses ever, clinical medicine 1, 2, and 3. Don't think that all your struggle is over and you're home free now. Unfortunately, you're not, but at least now you will be getting paid for your struggles. You will have personal or family issues, days where you didn't sleep well the night before, or a patient or staff member or colleague who is rude or disrespectful. You will make mistakes and get down on yourself. Nevertheless, don't forget that you have mental toughness and resilience and that you can do this. You have already demonstrated that. Find confidence in that. You've done it before, you can do it again. By advocating for mental toughness and resilience, however, I don't mean that you should always just grin and bear it. Address what problems you can with your patients or colleagues professionally, calmly, and courteously, just like we do in our political discourse in our country right now. That's a joke, sorry. Be brave and courageous, but also try to still have patience, respect, and perseverance. Remember the serenity prayer. God, grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. My next piece of advice is not only for new PAs, but for all of us, but especially for you young, bright, influential people such as yourselves. Remember that for our institutions and democracy to work best, they need the involvement of thoughtful, kind, and concerned citizens such as yourselves. Make it your purpose to find out what is going on in your workplace, your community, your state, your country, and the greater world too. When you see room for improvement, work for that improvement or change. Be an advocate for your patients and be an advocate or a positive ambassador for your profession as well. But also be an advocate and an agent of change for a better community, state, country, and world. So, in finally closing, I'm going to recite from Robert Frost. And no, it's not The Road Not Taken, although I do love that poem too. The poem is Birches, and I quoted this poem in my medical school application essay 36 years ago. So I think I've just been waiting for the opportunity to use it again. I think it describes well striving for joy and personal achievement, but also how hard life can be at times, and how real fulfillment and love occurs from coming back to earth and spreading some of the fruits of the climbing or striving. In the poem, Frost sees a grove of bent-over birch trees, likely from an ice storm. However, he imagines a young boy climbing them to their tops until he bends them over and rides them back to earth. I like to think of the climbing phase as our preparation or learning or whatever we do for fun or to escape our troubles. And then when the birch tree bends us back to earth, that is when we interact with and give back to others, such as in the practice of medicine. Anyway, here's part of it. He always kept his poise to the top branches, climbing carefully with the same pains you use to fill a cup, up to the brim and even above the brim. Then he flung outward, feet first, with a swish, kicking his way down through the air to the ground. So was I once myself a swinger of birches, and so I dream of going back to be. It's when I'm weary of considerations and life is too much like a pathless wood, where your face burns and tickles with the cobwebs broken across it, and one eye is weeping from a twig's having lashed across it open. I'd like to get away from earth a while and then come back to it and begin over. May no fate willfully misunderstand me and half grant what I wish and snatch me away not to return. Earth's the right place for love. I don't know where it's likely to go better. I'd like to go by climbing a birch tree and climb black branches up a snow-white trunk toward heaven till the tree could bear no more, but dipped its top and set me down again. That would be good, both going and coming back. One could do worse than be a swinger of birches. Class of 2026, my new colleagues, you've now climbed at least one birch. Now kick out and spread your knowledge, skill, and love on earth. I've enjoyed getting to know each and every one of you, and I know you will do great things. Good luck and Godspeed.
Thank you, Ben. Boy, that was profound, really great. My husband is a lover of Robert Frost, so I'll reference that when I tell him. Next, we're going to welcome your class president. So I'm excited to invite to the podium Madison Floriano, the president of the class.
Hi. Okay. Good afternoon, faculty, family, friends, and fellow graduates. Like she said, my name is Madison Floriano, and I've had the incredible honor of serving as president for the physician assistant class of 2026. Graduation day is finally here, and somehow we've survived. And by survived, I mean the exams, the stress, the group projects, the lack of sleep, and the moments where we were all one minor inconvenience away from a complete mental breakdown. But somehow we made it. Looking back, these past 2 years have been a whirlwind of long nights, early mornings, caffeine addictions, and trying to convince ourselves that I'll just study tomorrow was a solid plan. We've gone through moments where we've doubted ourselves, felt overwhelmed, and wonder if we were ever gonna make it to this day. But the amazing thing is, we never had to do it alone. Somewhere between the chaos, the exhaustion, we became a family. We celebrated each other's wins, encouraged each other through the failures, shared notes and snacks, and occasionally the panic attack before an exam. And even though there were moments that felt impossible at the time, I think one day we'll look back and laugh at it all. Maybe not the group projects, but most of it. But beyond everything we learned in the classrooms, the clinics, and the textbooks, I think the biggest lesson we learned is just how resilient we really are. We learned how to keep showing up even when we were exhausted, how to support each other, how to move forward even when life outside of school didn't stop feeling hard. I also want to take a moment to honor someone who has been my greatest inspiration, my grandmother. She passed away while I was in college, and today also happens to be her birthday. I can't think of a better way to celebrate her than by standing here and sharing this milestone with all of you. She taught me that even when life gets hard, you keep going, with kindness, humor, and determination. Everything I've accomplished, I've carried a piece of her with me. And I know many of you have the people in your lives who have done the same for you. So while today is about celebrating our accomplishments, let's also remember to say thank you to the people who helped us get here, whether they're with us physically or not. And lastly, to my classmates, thank you for making this journey absolutely unforgettable. Thank you for the laughs, the memories, the encouragement, and for proving that even during the hardest moments, none of us were ever truly alone. And now, as we move into this next chapter of our lives, whether you end up in a clinic, a hospital, an operating room, a trauma bay, or somewhere completely unexpected, I know every single one of you is going to accomplish great things. The compassion, resilience, and determination sitting in this room today will change lives far beyond the walls of this room. Thank you again, and congrats to the class of 2026. I have awards too. Thank you. Okay, so our class also wanted to do something to recognize the faculty who got us here. So we made some awards. Okay, so the first award we have is going to be if you guys hear your name, please come up. Okay, so the first award we have is going to be the glass is half full. This award goes to an educator who is being recognized for their persistent, positive, and lighthearted attitude towards teaching, Professor A.D. The next award is for Outstanding Mentor. This award is given to someone who is approachable, takes the time to listen, and helps you grow, and offers phenomenal advice, Professor Green. I'm persistent. Okay, Calm in the Chaos is the next award. This award is given to the professor who is likely to keep their cool in any stressful situation and has a very calming presence, Professor Powers. Next is going to be the heart of the school. And though he is no longer a part of the school, this award is going to a professor who embodies the spirit of the fighting squirrels with their unwavering care, compassion, and always down to give a good joke, Dr. Farley. And lastly, Dr. Esteban. She is getting the award for Clinical Pearl Dropper. She always is able to give the most critical, high yield, and memorable tips that you will actually use, whether we use them in clinical year or for our pants. So, Dr. Esteban, would you please come forward? Thank you guys so much, and thank family and friends for coming and joining us today. Congrats, class of 2026.
Now it's out of order. Yep. You're going to read it. It says Megan.
At this time, we will have our graduates stand and exit for the presentation of their white coats. We'll give them a few minutes to get organized for this.
I got you. And you'll do that when,
I can let them line up a little bit so they can hear it,
okay.
and it's not so loud.
Right by yours, right?
That's what Megan told me to do. Okay, as our graduates get organized, I'd like to introduce what this ceremony is all about. The long white coat is a symbol of professional identity, clinical responsibility, and the transition from student to healthcare provider. For physician assistants, it represents a commitment to compassionate, patient-centered care, lifelong learning, and upholding the highest standards of medical practice. As our graduates don the long white coat, they step into their roles as trusted members of the healthcare team, ready to serve with knowledge, integrity, and dedication to their patients and communities. We welcome and encourage a short celebration of applause and cheers for each of our graduates. Caroline Berry. Catherine Berta. Caroline Bulliard. Talon Brunson. Madison Chapman. Mason Cobb. Alyssa Conrad. We all need a sister like that. Olivia Egan. Emmy Malcolm. Sierra McCants. Justin McDermott. Rachel McGurl. Tate McLean. Reagan Miller. Sophia O'Keefe. Diana Polovic. Jamie Price. Juliana Provenzale. Megan Rinaldi. Julia Rill. Kristen Salter. Julia Shreve. Catherine Smith. Bill Tosick. Jenna Tusher. Katie Williams. Hannah Williamson. Mead Wilson. And Shelby Yeomans. You guys are a wonderfully supportive audience. Please, one more round of applause for all of our graduates.
This can come on in. You guys might be the rowdiest crowd we've ever had. We didn't get security for this, so calm down, right? All right, so inside everyone's program, you're going to see the PA professional oath. My new colleagues, please keep standing. PAs in the audience, as well as our graduates, please stand and recite the oath along with me. I pledge to perform the duties with honesty and dedication. I will hold as my primary responsibility the health, safety, welfare, and dignity of all human beings. I will uphold the tenets of patient autonomy, beneficence, non-maleficence, and justice. I will recognize and promote the value of diversity. I will not discriminate. I will treat equally all persons who seek my care. I will hold in confidence the patient-specific information shared in the course of practicing medicine. I will actively seek to expand my knowledge and skills, keeping abreast of advances in medicine. I will assess my personal capabilities and limitations, striving always to improve my practice of medicine. I will work with other members of the healthcare team to provide compassionate and effective care of patients. I will use my knowledge and experience to contribute to a healthy community and the improvement of public health. I will respect my professional relationship with all members of my healthcare team. I will share and expand my clinical and professional knowledge with PAs and PA students. These duties are pledged with sincerity upon my honor. To my new colleagues, congratulations.
Congratulations. Congratulations. You may be seated. We would like to extend a big thanks to the Virginia Academy of Physician Assistants, or VAPA, for generously providing the white coats for today's ceremony. VAPA is the professional organization representing the physician assistants across the Commonwealth of Virginia, dedicated to advancing the PA profession through advocacy, education, collaboration. VAPA plays a vital role in supporting both practicing PAs and students. For PA students in particular, VAPA offers mentorship, networking opportunities, educational resources, and a strong voice in legislative matters that impact healthcare delivery and PA practice in our state, Virginia. We are grateful for VAPA's continued commitment to the future of our profession and for helping to mark this important milestone in our students' journey with the gift of their white coats. For those students who will be living and working in Virginia, I encourage them to continue their membership with Virginia Academy of PAs. By doing so, they will be part of an organization dedicated to advocating for policies that allow PAs to practice at the highest level of their education, training, and expertise. I've got something I want to read too. It's one of my favorite Irish blessings. I'm just going to do a quick excerpt from it. Someone read this at my graduation. It means a lot. I held on to it for a long time. May the road rise to meet you. May the wind be always at your back. May the sun shine warm upon your face. The rains fall soft upon your fields. And until we meet again, may God hold you in the palm of his hand. Thank you.
Hello, class of 2026. You are quite busy in and out of the classroom, so I get to do a little summary of what you did over the past 27 months. It's like a trigger warning, I guess. So let's highlight some of the things you've done to show us the dedication of becoming a PA and advancing the PA profession. You took a lot of tests, and I'm sure all your friends and family and loved ones who are here today heard a lot about them. I know we certainly did as faculty. I'm not worried about this class advocating for your patients. I think you're all going to be wild advocates, and I love that. Keep it up. But you completed 85 didactic phase exams, 9 clinical phase exams, 2 full PACRAT exams that were 250 questions each. You had too many quizzes to even count with numbers. You had 8 full days of standardized patient hands-on examinations, 318 mock patient interactions that I know you loved, and 1,820 written SOAP notes submitted in the past 27 months. Just to note the faculty workload, we had to grade those. And my personal favorite, they were forced to memorize the brand and generic names of the top 200 drugs prescribed in the United States. You're welcome. Outside the classroom, these students raised over $3,000 for various charitable organizations and class events, a huge number. And once you all entered the clinical phase of the program, you saw and cared for 58,174 patients. And finally, to put all of their hard work into perspective for this last clinical year, you logged as a class 73,943 hours of patient care during your clinical phase of the program. We're so proud of you.
For 15 months, these students immersed themselves in an intense and comprehensive curriculum, building a strong foundation in anatomy and pathophysiology, developing into clinical reasoners, and learning how to critically evaluate medical research and literature. During this time, they worked through clinical medicine, mastering pharmacology, refined their history and physical exam skills, and explored healthcare policy, ethics, and population. They also gained an appreciation for the history of the PA profession and began preparing for the hands-on clinical phase ahead through the development of essential clinical skills. It is a phase defined by long hours, constant learning, trauma bonding, and the challenge of turning information into understanding. While every student successfully met that challenge, one individual distinguished themselves by achieving the highest overall GPA across the entire didactic curriculum. This award was decided down to the 3rd decimal place. The Didactic Excellence Award recognizes not only academic excellence, but also the discipline, consistency, and commitment required to master the science behind patient care. It is my honor to present the Didactic Excellence Award to Lauren Hall. Hold on just 1 second. Okay, sorry. 1 second. I was afraid to look. Sorry. No, you're fine. There you go.
All right, so on to the clinical phase. The clinical phase of our program is a year long and consists of 8 6-week rotations where these students have gone through the core areas of medicine, including behavioral health, emergency medicine, family practice, internal medicine, pediatrics, surgery, women's health, and an elective of their choice. They get to choose what excites them and explore other opportunities. This year, we will be highlighting student excellence in each of those areas of medicine. The students that are receiving these awards scored the highest percentage overall in each of these specialties when their grade was determined by preceptor evaluations, knowledge-based exams and presentations, the patient encounters that they logged, application of billing and coding principles, and various learning modules that aligned with where they were. Demonstrating clinical academic excellence in behavioral health is Olivia Egan. Demonstrating clinical academic excellence in emergency medicine is Jenna Tusher. Demonstrating clinical academic excellence in family medicine, Tate McLean. I love the family love. It's great. All right. Demonstrating clinical academic excellence in internal medicine, Hannah Williamson. Should have let Dr. Esteban, our pediatrician, give this one out, but I'll do it since I'm here. Demonstrating clinical academic excellence in pediatric medicine is Caroline Boyard. Clinical academic excellence in general surgery goes to Julia Rill. In women's health, we had a tie, even down to the third decimal place, but I didn't go any further because I want to celebrate everyone, okay? Demonstrating clinical academic excellence in women's health is Sophia Hoffman and Meade Wilson. All right. Hold on. I'm out of order here. This next student demonstrated clinical academic excellence in their area of elective choice, which for this student was trauma surgery. Quite a daunting task to take on as a PA student. This award goes to Sophia O'Keefe. All right, our next award is for the overall Clinical Excellence Award. This recipient was praised throughout the clinical phase of the program by their preceptors, and for the next few awards, I pulled some of those comments because I enjoy reading them, and I feel like you will enjoy hearing about these great students. So a preceptor said, "This is one of the strongest students I've ever had the opportunity to train. This student has the knowledge that exceeds that of anyone I've ever worked with, including medical students and residents. Any office or hospital would be lucky to have such a talented PA on their team. I'd offer this student a job today if I could." And this came out of one of their first 2 evaluations. Excelling with the highest running clinical year grade is this year's overall Clinical Excellence Award recipient, Sierra McCants. Yeah, okay. This next, way to go, everybody. Right? This next award that I'm presenting is for PA Student of the Year. So the PA Student of the Year award is given to a student who exemplifies the traits and qualities of an outstanding PA. So let's share some of those comments about this student. Over the years of evaluating and precepting students, there are a few individuals who stand out as truly exceptional. The members of our team are of the conjecture that this student is one of the most phenomenal we have ever had the opportunity and joy to teach. This is based on daily observation and interaction, and I stand behind giving this student a perfect score on their evaluation, which we have never done before. And this site takes a student every rotation since the beginning of our program. This student exhibited a surprising breadth of knowledge and a genuine asset to our team. Additionally, this student was humble, teachable, and exhibited a cheerful, pleasant disposition. I'm truly honored to have had the opportunity to teach them. This year's 2026 PA Student of the Year Award goes to Julia Real. Up next is the Linda Seastead Stanford Leadership Award. This award is given to a student who exhibits excellence in academics, clinical performance, and in service and leadership activities during their time in the program. Here we go with the preceptor comments. This student consistently arrived prepared, engaged actively in patient care, and demonstrated professionalism, compassion, and respect towards patients, families, and staff. They are possibly the most well-rounded and well-prepared student I've ever worked with in my 20-year career. The rapport built with patients and staff was exceptional. This student's peers would agree that leadership is a quality that she exudes day in and day out. Spoiler alert. This year's recipient of the Linda Seastead Stanford Leadership Award goes to none other than Madison Floriano. All right. The Outstanding Preceptor Award honors a clinician who consistently goes above and beyond in their role, demonstrating not only exceptional clinical skill, but also in lasting dedication to educating and guiding our PA students. This award is presented to a preceptor whose continued excellence in clinical teaching has had a significant and positive impact on our program through their unwavering support, professional leadership, and enthusiasm for shaping future PAs. In reviewing the students' evaluations of their preceptor, I could go on for hours. They write phenomenal things about this person. But I think this student nomination sums it up. This preceptor is by far the best educator I've had in my entire academic experience. Throughout my rotation, they consistently went above and beyond the expectations of a preceptor, demonstrating not only outstanding medical knowledge and patient care, but also a genuine passion for teaching and mentorship. What sets this preceptor apart is their ability to create a supportive yet challenging learning environment. They encouraged me to think critically, ask questions, and take ownership of my clinical decision-making, all while providing thoughtful guidance and constructive feedback. This preceptor's teaching style fostered both confidence and competence, allowing me to grow as a future PA. In addition to their clinical and educational strengths, they exemplify professionalism, compassion, and leadership in every patient interaction. They lead by example, showing what it truly means to provide patient-centered care while maintaining efficiency in a fast-paced setting. Their respect for patients and colleagues alike left a lasting impression on me and shaped the way I hope to practice. I cannot think of anyone more deserving of this recognition, as this person truly embodies the spirit of excellence, leadership, and commitment. The 2026 Outstanding Preceptor of the Year Award goes to one of our most outstanding preceptors, Chris Klemick.
Wow. It's an exciting day for you guys. There's a lot of opportunities ahead of you. I'm glad to be a small part of it. You did a great job thanking your faculty. I can tell you, as the parent of 2 teenagers, your parents did a lot to get you here too. So make sure you thank them. Your faculty gets you shined up, so I meet you well into your experience, and so they do a wonderful job of getting you prepared to take on new challenges. And thank your spouses or your significant other. I often get caught up because I tell people, my wife and I were in PA school, and they give a predictable response of saying, "Your wife's a PA?" And I say, no, she just was there when I was going through it. And so they do a lot for you too. But today is your day. You don't get very many days like this in your life. So congratulations. I wish you guys the best.
Okay. Are all our ducks in a row? Okay. Good. Scholarship, service, leadership. This is the motto of Pi Alpha, the Honor Society for Physician Assistants. The Pi Alpha Honor Society was organized in 2004 by the Association of Physician Assistant Programs for the promotion and recognition of significant academic achievement, leadership, research, community, and professional service in the encouragement of a high standard of character and conduct amongst PA students and graduates. To be eligible for this prestigious award, students must maintain a minimum of a 3.5 grade point average and demonstrate excellence in one or more of the following areas: research, publishing, community and professional services, or leadership activities. We are proud to recognize 6 graduates, sorry, I can count sometimes, from the class of 2026. I will present these awards in alphabetical order. When your name is called, please remain up front for this recognition. Carolyn Bolliard. Let me just make sure. Lauren Hall. Sierra McCants. Sophia O'Keefe. Diana Polovic. And Hannah Williamson. It is my distinct honor to introduce to you a colleague whose dedication to medical education, has left a lasting impression on every student fortunate to learn from her. Caitlin Powers joined our program 5 years ago, I think, and in that time, she's become one of the most respected and beloved educators in our faculty. Her commitment to excellence is reflected not only in the classroom, but in every clinical encounter she models for our students. Whether guiding them through the nuances of clinical medicine, sharpening their hands on clinical skills, or illuminating the art of diagnostic radiology, Professor Powers brings a rare combination of expertise, patience, and passion to everything she teaches. She is a gifted instructor, the kind who makes complex concepts accessible, who meets students where they are, and who inspires confidence in the next generation of medical professions. It is no surprise that her peers recently recognized her outstanding contributions with her well-deserved promotion to associate professor. Today, we celebrate not only her academic achievement, but the profound impact she has made on this program and on the students whose careers she has helped shape. Please join me in congratulating Professor Powers as she is initiated into Pi Alpha, an honor she has more than earned. Did you get some feels? Yeah, I did. Thank you.
All right, and now we have a short video of highlights of photos to celebrate our graduates.
building of Murphy-Deming.
Fortunate. But lastly, I just want to say